It's my pleasure now to introduce Professor Jackie Bowden, the Director of the National Centre for Education and Training on Addiction, who needs no introduction, but I will. She is a behavioural scientist with more than 20 years' experience with tobacco, alcohol and other drugs to provide our director's welcome. Please welcome Jackie.
Thank you very much, Rob and Natalia Cliffy. So, just check that we have some slides. Thank you very much. So thank you everyone for turning up today. We really appreciate it. What a beautiful view we have. Please, if you can focus on the front, but I understand if you daze off and look into that beautiful view. And also a very special thank you to everyone joining us online. I too would like to pay my respects to elders past and present and acknowledge the Kaurna people of the lands that we're meeting on today and of which NCETA is located. Because we have a jam-packed program today, Cliffy has done the welcome and I'm doing the acknowledgement of country on behalf of our team. In terms of our program, we have a jam-packed program, as I've mentioned. We've got an official welcome by Marina Beauchamp, Chief Executive of Preventive Health SA, an exciting FASD session, so fetal alcohol spectrum disorder session with guest speakers, including Sophie Harrington talking about her lived experience and also some tools that are available for health professionals in the FASD space. Professor Elizabeth Elliott and Dr. Susie Burns, who will be on a panel after that. You'll be hearing about our latest workforce development and alcohol, tobacco, e-cigarettes and other drugs research. And then you'll hear from Associate Professor Caitlin Hughes about approaches for prisoner reintegration. And at the end of the day, a whirlwind approach to our tobacco and e-cigarette research. So some housekeeping. If you can please keep your mobile phones to silent. We have catering, which is very important, we know, provided. Toilets are just outside here. You're welcome to come and go as you please and need. There's a door at the back there if you'd like to use that, but you're also welcome to come in and out. We'd like to keep this as fairly informal as we can. Questions, we would love to encourage those at the end of each session. Online questions via the chat. I know we have quite a number of people that have registered online and we'd love to hear some questions via that chat, and we have someone checking that out. And we'll be recording those sessions that have published work and sharing them online. Just a little note, we are providing some hot off the press findings for you today. We do encourage photography for your own purposes, but if you could just please not share them online at the moment until we publish those findings. So just a little bit about NCETA. We turned 34 last week. We're established with funding from the ARC initially, and from mid-1999, we began receiving competitive core funding through the Australian Government Department of Health, Disability and Ageing. So NCETA is based in Bedford Park, so down the bottom there, but Flinders University have campuses all the way up the Central Corridor. And I'd like to acknowledge those lands as well as Aboriginal lands upon which those campuses are located. And we have work in those spaces too. But a lot of the work we're focusing on today kind of has a bit of a national focus and sometimes a bit of a South Australian focus as well. So in terms of our purpose and priorities, we aim to conduct and disseminate world-class research that advances knowledge, innovation and evidence-based practice to minimise harms associated with AOD use. We have a line of work to strengthen capacity in Australia's AOD services and specialist and generalist workforces as well. And then we aim to strengthen the evidence base to prevent AOD harms in Australia and internationally. And we really engage in building strong partnerships and collaborations and have multidisciplinary teams. So just a bit about us. Up the top, this is our alcohol and other drug research team. We have a workforce development research focus. We've just brought in Annika Theodolou, who will be presenting later today. She's from Oxford University in the UK and a Cochrane systematic reviewer. Special thanks, and I think she might have just run out of the room, to Sarah Powell, our operations manager, who's done a fantastic job at organising today and making everything happen. A new substance use research and evaluation program that Marina will talk a little bit about today. Our PhD students, and you'll hear from some of those. We also have an extended team, the Flinders Nicotine and Tobacco Research Group, and you'll hear from a number of those. Chris Holmwood, who's here in the room, our addiction medicine specialist and consultant, and Professor James Smith. I'd also like to thank our advisory board, many of whom are here today or online, and they bring a diverse range of strengths to our work and different areas of focus, and we very much appreciate their ongoing support and guidance as we set our strategic directions. And also they help us translate our research into practice as well. I'd like to acknowledge all of our funders, and many of them Australian Government Department of Health, Disability and Ageing and Preventive Health SA in particular, that fund a lot of our platform work. But then we receive a lot of grant funding from a range of these sources here as well. So just a bit of context for the day. This slide shows you kind of the prevalence of alcohol, tobacco, e-cigarettes and other drugs in South Australia, but it's a similar pattern nationally. You can see here the top line shows we're seeing declines in risky alcohol consumption, which is fabulous, but we still have around a third of Australians, or South Australians, drinking in excess of the guidelines, which is concerning. And then we're kind of seeing stable sort of focus in illicit drugs. We're seeing some increases in cocaine, vaping and cannabis, and we're seeing reductions in daily smoking. These are all, many of these are good news stories, but we do have a long way to go. It's important to remember that tobacco is probably the most harmful substance in Australia, followed by alcohol, and then all the other illicit drugs have some significant health concerns when used problematically, and that's important to be mindful of. So just a note for the day, I'd like to thank our chairs and speakers. We encourage questions and engagement at the end of the sessions and also within breaks. Thank you very much for attending, and just want to acknowledge our multidisciplinary focus, and in our collective pursuit of scientific advancement, collaboration is key. By uniting diverse experience, we accelerate the journey from research to impact, ensuring that our research makes a meaningful difference in people's lives. And that's what we're here today. We've got a lot of lived experience. We've got policymakers, we've got people on the front line, and we've got researchers. And I very much welcome your engagement throughout the day. And thank you very much for your interest.